Thank you very much. Okay, let's open up the floor for discussion. Questions?
Question about how you can calculate the value of perfect information. Question about how you can calculate the value of perfect information when you have unknown unknowns. For example, what's the probability that, say, supporting charter schools is a bad decision? How might you try to calculate that?
It's a great question. I think the expected value of perfect information by definition is an expected value. And so you actually integrate out stochastic uncertainty, just like you integrate out stochastic uncertainty when you form expected cost-benefit ratio or expected net monetary benefits. Is it working right?
Yes.
Was that?
We need to turn that.
Oh, turn that on. All right. So what you do is it's a probability that your current decision may be wrong, which is exactly the estimate that Steve was providing to decision makers in terms of what fraction of the simulation is actually giving you negative benefits. And then you add to that the loss function that if the alternative were true, if the policy that you select today was wrong and the alternative policy was true, you could actually calculate from your analysis the expected value that you would get if the alternative was true. So that calculation is very straightforward. Although sometimes depending on the model you're using, it could be an elaborate process. So we have done both maximal modeling approaches and minimal modeling approaches to calculate those. But the stochastic uncertainty is if unknown are averaged out.
Other questions?
Lynn, I wanted to come back to the question you said with preventive programs. And, early childhood's probably not going to make so much difference if we start at 0 or 3, but some of the preventive interventions do start at age 12 or in the middle school years, et cetera. And I wonder, what your thoughts are about, with these preventive interventions, you might have to discount to different ages, it would seem to me.
So actually in the paper that I wrote on sort of moving towards standards for early childhood interventions, I argued that for those interventions in particular, we should think about birth as a standard point because that's sort of the earliest starting point. But that it would also be, even for those interventions, instructive to think about, say, in age 5, because that might be a standard for school-age interventions. And so we could agree that, or 5 or 6 or maybe 8, depending upon where you're drawing that dividing line between early and traditional school ages, and so that we'd have sort of a meeting point there. But maybe we'd also want to even think about discounting to birth for the school-age intervention. So if we had a couple of standard points that we knew we would always be able to compare to, then I think, and you would always still be free to do it to age 15 or 16 or 12 or wherever your intervention starts. But again, it's a base case for comparison with other studies.
I guess on that one, from a decision maker's point of view, I don't know why you wouldn't just discount to the point at which the main part of the money's going out the door. For when the intervention is going to actually begin. Because at some point you might be comparing this to a workforce program where it's people who in their 30s who are getting the intervention. You're not obviously going to discount them back to birth or 5.
Yeah, I think it's sort of, the way I've been thinking about this is if you thought about a cohort of kids and I have a certain pool of money to invest, what's my optimal investment strategy? And you might even think about it in sort of the portfolio context. So you're right, if I'm thinking about investing in adults now versus kids now, that's a different calculus than if I'm thinking about over a time horizon, thinking about a portfolio or an investment strategy for a given cohort where I have this time path over which I can make the investments. I think depending upon the decision-making problem, it's going to depend upon how you're thinking about what those alternative choices are.
Yeah, decision makers seem like they're more often in the point they have a pot of money for a given year and they have to figure out how to spend it.
Right.
In which case you want to discount it to the year that money's going to be going out the door, really.
Yeah, again, it's, I guess another way of thinking about it is, do we want to give decision makers the information to help them think about more of a life course investment strategy or portfolio strategy, rather than always it's today's decision, I've got the money today to invest here or later. And often, you know, when you're hearing the choices that, the trade-offs that are being made, you're definitely thinking about, am I investing the money today in today's 0-year-olds or today's 12-year-olds? But also I have to be thinking about the 0-year-olds today, and when they're going to be 12, what should I have been doing for them relative to, you know, this time period over which I could be making investments. So I think you know, it's partly a matter of how decision makers are looking at the problems.
So I have a question that that didn't come up, which is, it seems to be that we would also want to take account of the fact that some, what is the pattern of investments? So some things have high upfront costs and the benefits come down the road. Other things have low upfront costs and maybe immediate or a trickle of benefits over time. And this is important from the perspective of a policymaker, because if you need to put all the money in, it's like buying a house. Are you buying a house or you're buying consumables? So it's just another thing you might want to put on your list.
Yeah, I would say I would put that among the, like a break-even analysis. How many years does it take until the cumulative benefits exceed the cumulative costs? And in a way, I think of that as another summary measure of the outcome of your analysis. And indeed, I agree. I think that would be something you could report as a standard. You know, it's going to take so many years until you see. And that can be quite different. Even in the early childhood field, when we looked at, for example, nurse-family partnership, it had a much faster break-even point, largely because the parents, the mothers, were generating benefits from the very beginning, reduced welfare use, higher earnings, and so on and so forth. You didn't have to wait until the kids were age, you know, school age or later to see their, you know, added benefits. So depending upon the intervention, you can see, you know, faster returns. I mean, one issue there, I think, and this didn't come up, it came up a little bit yesterday around, you know, what outcomes we measure, is that for interventions that happen, let's say it's early childhood and you're focusing on the child, you know, there's a question of, would we expect changes for the parents as well? And in some cases, you want to capture those because they can be benefits that accumulate right away, that you can, you know, kind of count in your analysis right away. But if you're a study that didn't think to measure that, you're going to be disadvantaged in some sense in a benefit cost analysis relative to a program that did. So I think another reason for thinking about some standards around what outcomes you measure is so that you have that ability to look across these interventions in a comparable way, and those kinds of calculations would be more even-handed.
Just to add that it's kind of, from a discount rate, kind of tries to address that situation so to increase comparability, because everything is net present value. And so if you have costs up front and benefits later on, I mean, it discounts the benefits more than it discounts the costs. And so you would have differences in two interventions who have the same overall expected cost and benefits, but they accrue at this different time. The discounting would give you different results. And kind of that's a contentious issue, because I wanted to ask Dick, is that, you know, do you also see that whether we should be discounting benefits differently than costs? Because that's something at least the World Health Organization and Gates Foundation seems to be leaning towards, without very clear justification as to why that should be the case.
I'm missing something here, Bon. I mean, I don't know, I don't see what the issue is.
Well, the issue is whether we should be discounting costs at different rates.
But, okay, why? Well, why? Why shouldn't?
Well, there are these intergenerational equity issues and all those kinds of things. Well, that's what they say.
It sounds like a bad idea to me.
That's good to know. You're on the same page.
To follow up for a question for Dick, since you stopped mid-sentence, earlier, you were talking about, it seemed to me, really wanting to use the 7% discount rate. And obviously, a lot of these cost-benefit analysis have used 3 and 7 or some, but a lot of them have really focused on 3%. And I'd love to hear your thoughts about that. Again, having looked at Lynn's summary of the early childhood education programs that she put up.
And your question is?
Well, a lot of the folks are using the 3% discount rate, not the 7% discount rate.
That's true. And so your question is?
It seems that you were promoting that we ought to be using the 7% discount rate, even though programs tend to use the 3% discount rate.
That's true.
Okay, that's it, okay. You think they're wrong. You think they're wrong, that's true. Okay,
Well,
thank you.
I'm talking about, I'm really my emphasis, I want my emphasis to be on what the approach is, and that's why I gave the two fundamental ideas to determine the approach. If you were doing it project by project, and you could easily determine how much of it came from the cost of the project, came from the cost of capital, private capital, and how much of it came from consumption. What happens is that the rate you normally think about as for the consumption rate of interest is sort of the pre-tax private return to individuals, and that is reckoned to be generally about 3.5%. And so that the complete range would be, that I would talk about using, would be from 3.5% to 8.5, 8.5 being the case when you have it's completely funded by private capital. But if you, the problem is that it's expensive to determine project by project where the funding is coming from exactly, how much of it displaces private capital and how much of it comes from consumption. So that 6 to 8% that I suggested possibly really comes from sort of the average project. But you could make a case for particular projects for as low as 3.5 or as high as 8.5. The reason the 3.5% rates, I mean, I think I really want to avoid using principles, developing principles on the basis of what people have done or think is, because there's very little, in my view, justification for some of the low rates. First, I think there's an agency, a natural, and I got this from Margaret, really, and I think it's an important point. There's a natural agency bias toward lower rates insofar as agencies want to fund their own projects, the projects that they suggest. So it's an understandable, if you're proposing as an agency, you're proposing a series of projects, and you're using the 7% discount rate, you're not going to have as many projects as an agency competitive agency that's using 3%. So I think that's a natural bias. Secondly, those 3.5% rates generally are based upon time preference considerations of some sort. And the problem is, you really have to take into account the capital penalty, which involves the displacement of some private capital. I don't think you can get away from that. It becomes more complicated when we get into the issue of time declining rates, where we get other considerations. But, for example, I'm going on here now, making up for my last sentence. ERA and a bunch of very respected economists have a short article in a recent issue of Science. And what they do is they say, well, we think the time preference rates, which I don't think is where you want to start, but the time preference rates really vary from 1 to 7%. They don't have any evidence for that. They really just assume this. They just assume 1 to 7%. And then what they do is they calculate, they said, well, we don't know between 1 and 7% which is the right rate. So we're going to give them each equal weight, and we're going to calculate certainty equivalence. And they calculate that in time, and they get this time declining discount rate that varies between about 3.9%, something like that, 3.74, I think, and 1%. It asymptotes to 1 at the region. And so they suggest this is the rate. If you start with the Burgess-Zerbe, the range from 3.5 to 8.5, with a range to be usually used between 6 and 8, you end up with, in calculate certainty equivalence, you get a very different time declining set of rates.
I'm afraid I'm going to have to cut you off again, Dr. Zerbe.
Okay, I'm done.
We've run out of time for this session. There will be a short break after this, and I would like to give our panelists another round of applause. For their excellent